Assalamualaikum warahmatullahi wabarakatuh. I try in English. I have handled a client. He has avoidant personality disorder, not far away from social phobia, like something like he also has a social phobia. I have seen him for 5 times, and I haven't get great improvement from him because I still have difficulties with him to find his faulty belief on him. The problem of him start when he was a child. He have been humiliating because of he has a difficulties in learning, and then he was labeled as a stupid boy. So he felt that I am stupid. I cannot do anything right. So the parent sent him to what we call SLB, School for Idiot People, something like this. Actually, he's not idiot. He's just have difficulties in learning. So now he 32 years old, and he.
How old is he now?
32 years old. He now 32 years old, and he inhibit himself from social interaction. He has no social interaction at all right now. He has no friend, no close friend, no job, no social activities. He just in his house with his family where he can feel so feel safe in his house. I try to give him a right perspective in Islam, that in Islam you have you're not as idiot as you think. I said to him, you have to appreciate yourself. I held IQ test for him, and he's in the level average, not like he feel all this time he's idiot. No, he's not idiot. He's in average level. I told him, you're not as bad as you think. I told him right there. And Allah has given you very great potential for you to improve yourself, to develop yourself. I said to him, I tried to restructure his cognitive. But I think I haven't gave him enough encourage for him to try to get interact in social, because until now he still haven't got self-confidence to have social interaction. All this time he haven't get a job, interaction with social in a large school like that, only in the house. For 2 sessions, I give him an activity to have interaction outside of the door in his house. He began to try to have conversation with people outside his house. But after that dia menarik diri lagi. He doubt again. He feel not confident to have interaction again. Just like that, circling like that, because he really internalized that I am idiot. He's still like that. I'm idiot. I cannot do anything like that. So I'm really right now. I need your advice. Maybe how should I convince and encourage him that you're not as bad as he is not as bad as he thinks, and he has the great potential to develop. because his parent is already old, and if he's still continuing like this, his parent very when they die and this boy still like this, they very concerned about their child. Thank you.
Yes, you see, this young man have already, this is what is called reading a conception of a person about himself, which is fixed in child. This is called, the treatment is called schema therapy, cognitive therapy. But now, this child is also suffering from depression. He lived for so long and he feels he cannot do anything. Here it is not only pure cognitive therapy. It should be combined with antidepressants. You should go to a psychiatrist and help him to take the antidepressant, and at the same time you do cognitive therapy. This is number one. Number two, when he had taken the antidepressant, generally needs about 2 weeks to show its effect. When he begins to feel, I have some patients who were chronically depressed, and when they took an antidepressant, they discovered that they were depressed. They didn't know they had depression. But when they took the antidepressant and looked at life differently and at themselves, and they started to talk and become, then they said, how come now for 20 years we didn't know this? But the problem with antidepressant is that when you stop it, maybe there will be a relapse. So what you should do, as soon as the antidepressant begins to make him improve, you concentrate on cognitive therapy until he begins to change his habits for food. Even if the antidepressant is not given, Kalas, he had already made friends outside, he became The second thing that you can do is to find somebody who is of his age and who can be his friend. Another man who can come and talk to him and tell him, let us go together out in such a do this. Gradual, but not all of a sudden. Just to do self-defeating things to come out, the next day it becomes greater by gradual. Until he is convinced to take a minor job. First, the job in such a case should be something he can do at home. For example, if it is making of chairs, weaving, this plastic that you can do to make a chair. The frame of the chair is brought and he taught how to use the plastic rope to make it like a chair on which you sit. A simple job like this. Then, when he does this and excels in it, then he's convinced to go to the factory and help. These are steps that you can take in this direction. Also, if you can get a nice woman who can be interested in you and then he begins to fall in love, things might be, this will speed up things. Now you have so many possibilities, just go and see what you have. I'm sure one of them will do the job. Yes, go.
The second one.
Okay, Professor, I wonder, I hope this is not a silly question. I wonder whether, I mean, in what age minimum this kind of therapy can be applied? I mean, can we apply it to 10 years old boy or?
At any age, yes.
At any age, or at any age, or there is a minimum age, or whether there is any other precondition like it's okay with 9 years old girl as long as she is already able to dialogue. For example, I don't know, is there any precondition or minimum age that this kind of therapy can be applied? That is the first question. And the second question, what do you think about the, I don't know what is the terminology, some kind of like comprehensive approach, such as the suffering woman you mentioned before, that the husband is cruel, the husband is cruel. What I catch up from your presentation, the one that is treated or you give the treatment only the woman. What do you think about comprehensive approach? Can we maybe, as Muslim, can we maybe enter the family life maybe as the therapy? You can, a bit give some intervention to her husband, so not only healthy the woman mental health, but the whole family life is healthier. Not only that the woman can be a stronger woman, but what do you think? Don't you think the husband is also need to be intervened so he can be the better husband? As a Muslim therapist. Thank you.
Thank you. These are two very good questions. I think that the first issue, a 9-year-old can easily be treated because she has already she's mature, she can be treated with cognitive behaviors. And if you will reach the age of about maybe 7, 8, but you have to make it attractive to the child. But children who are younger you'll have to use different things. You'll have to use stories. Very interesting stories about people who are, if the child is afraid of something, then you are. And also, you will have to help you see children who are brave. Come and play with him. For example, a child afraid of dogs. Then you will bring someone with a dog. We'll go to Bandura. You know his real name is Bandura, not Bandura. But it's written here. Bandura. Yeah, and this kind of imitation. Yeah. Correct. So here, with young children, we cannot get into deep cognitive aspect. As for the second question, what was it concerning?
What is the comprehensive approach for the
Yes, the husband. Yeah, what will happen? Here we will be going into family therapy, in which you can bring the husband and the. But here it is obvious it is the woman who needed the therapy area. But you can, of course, bring in the husband if he is ready to facilitate, to help in the therapy. For example, to avoid over-frustrating her. But the issue is that this woman was in the hospital, being treated. I didn't see the husband coming to visit her. And because she was depressed, she did not even remember her kids, not even care for herself, her hair, or the way she was busy there. But one of the first things that showed us the better that she's being better is that after a few sessions, she started to take care of herself. Then she said she's longing to see her kids, and she went to see them. Now, this woman has already changed the whole situation. In the last sessions, before I left Morocco and before I ended her therapy, she told me, now I went home and I domesticated my husband. Yeah, I domesticated him. I made him like wine. We say that this become domestic, an animal when it is so dirty, then you domesticate it, then halal becomes mu'addab, it becomes mu'addab. So she said to me, now I dealt with my husband, now he's I. As for my boss, now I'm not afraid to go to him and face him publicly and even to tell the boss about what he did with me. I'm afraid. I'm not afraid. I can do it. But now I think I forgot the whole issue and I asked to be transferred from one place to a very far away other place where nobody knows me and I will start a new life. Now this was a brilliant woman. The issue here is that you said something very important. Because at times when you treat a patient, maybe the spouse will become also psychologically disordered. We had, I remember this very well, there was a case of a woman who had been like that. No, it was the man, I'm sorry. It was the man who was, the woman brought him to the clinic. This man, treat this man. Almost, she helped him from his feet like this. He was quite afraid of her, and unable. But she brought him to us. Look at this man, treat this man, because he's sexually impotent. If you can do something to him, he will become more active with me. I'm frustrated because of him. They have no shame there. They just say. So we treated the man. We treated him to become aggressive because he was non-aggressive. When he became aggressive, sexually he became okay. But then his wife became depressed and then. So when it became tough, we started to talk differently to her. All the time she looked at him as if he's a kambing. Now he's becoming the lion. So the adjustment from the change. So it is true at times we need to do family therapy. This can be done. This is the difficult. Yeah. Break for Zuba. Yeah, we are having a break for Zuba prayer. We can have a prayer.
We will have a breakfast for lunch and Dhuhr prayer. And we will go back to this room 12:30 inshallah. And question, you can write down your question as well, if, as much as you can. Then we can select the question if you want to. Okay. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Dr. Dean and Professor Malik. Now we're going to have our lunch break for about an hour. So you're expected to be back to the room at sharp 12:30. So please make sure you come back to the room on time so we don't lag behind. That's all. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.